Hello, and welcome back to my YouTube channel. Thank you so much for joining us again. As promised, I've got my superstar Anna here with me, one of my best friends, colleagues, business partners. Started off as my dental nurse, now is an incredible hygiene therapist. Well, actually she's a hygienist first, now she's a hygiene therapist, and works with me at Chelsea. So really excited to have her today, and I am so happy that I can reference this video back with lots of my patients and people that feel a bit confused, because I think generally the public don't know the differences between dentists and hygienists. They don't know who to go to for what. I often say to people, when's the last time you've been to the dentist? And they were like, 6 months ago, went to the hygienist. I'm like, that's not the same thing, but okay. You know, so we're going to iron out a few of those things for you today. We're going to talk about the differences between hygienists and dentists, who you go to for what, why it's important in my treatment planning as well, and at what point I converse with Anna, and how often you should go to us before and after treatments, especially big treatments like veneers and bonding. So without further ado, if you didn't watch our last video, I'll let Anna do a little introduction as well.
Hi, my name's Anna. I am a hygienist and therapist. Obviously, as Rhona said, we've been working together for a long time. No one starts a smile makeover journey until they've sort of been signed off by me. And then even when they've completed their smile journey, they still come back to me. You probably see me more often than you would see Rhona. And anything that I can't do obviously goes to Rhona, but a lot of the routine work that dentists carry out, I can actually carry out as well. And I'm really excited to be able to share that with you, as Rhona said, and help debunk a little bit about who does what and why.
So first of all, let's go into a dentist and their qualifications. I'm a general dentist, I'm not a specialist. There are dentists that go on after their general dentistry degrees and go and study specialty degrees. Some people just do masters or diplomas, and some people go on to the full specialist training. You're on the specialist list. And although I have a huge interest in cosmetic dentistry, there's no such thing as a cosmetic dentistry speciality, but I have dedicated a lot of my postgraduate training. So for example, I've done a diploma in Invisalign and also other courses that are related to designing smiles, and I continue to do that throughout my career. My degree takes 5 years, and then vocational training year, which is basically where I went off to a practice and did additional training so that I could work on the NHS. And I worked on the NHS for many years. I stopped about 2 to 3 years ago, and now I work in fully private practice. As a general dentist, you're fully qualified to do everything, i.e. you learn about root canal, you learn about gums and so forth. However, when you become a specialist, this is just my personal opinion, I believe that you acquire skills that the general dentist cannot do. So for example, teeth are very complicated. At my practice, I have employed specialists to ensure that my patients are getting the best care, because when they need a root canal treatment, I will send them to Dr. Aram, who will bring on the show. I am not a presenter. That is my inner voice speaking. But Dr. Aram will come on as well and talk about root canals. But again, although I'm qualified to do it, I would rather he does it, because he's got those skills and that training, and I like to stick to what I do. We can diagnose disease, we can take x-rays, we can do impressions, we can do all sorts of treatments, from fillings, veneers, crowns, bridges, dentures. If you go on and do even a weekend course in implants, you could do it. It's not something that I have personally done. Again, I've got somebody that's done oral surgery training, gum training as well, who do all of the implants. But in a nutshell, that is pretty much what a dentist can do. Now, if you want to have a full smile makeover, we always say that you need a consultation with me. You might have your first port of contact with my TCO, who's my treatment coordinator, who has got some dental knowledge, and say, okay, actually you need to see Dr. Aaron first, Dr. Mittel first, you know, various members of the team based on any photographs that you've taken. But when you come in, I will check for disease, and I will give a diagnosis on what's going on in your mouth, and then present you with a treatment plan. So that's, in a nutshell, what a dentist can do, and you've got the specialist and the general dentist as well. But I'm gonna let Anna talk about hygiene therapists as well, the differences, and what the differences are between us.
Okay, so first I qualified as a hygienist, which meant I spent 2 years solely learning all about how to prevent gum disease as well as treat gum disease. The majority of my work focuses around prevention of disease, but also not just gum disease, dental decay as well. I am your oral hygiene coach, okay? I create tailor-made treatment plans for you to make sure that you can maintain your oral health at home. What I do is 20%, you do the 80% at home. For me, obviously, if a patient comes in and they want to embark on a smile journey, your gums and the supporting tissues are the foundations for everything we do from there. So they have to be healthy. If there's bleeding or you're not brushing effectively, this could actually have a detrimental effect on the work that Rhona then does. So that's what a hygienist does. Traditionally, you may have heard words like scale and polish. That's not a term that we use where we work. We manage biofilm and we help manage your oral health and hygiene in various ways. As a dental therapist, I'm like a mini dentist, and I can carry out much of the routine work that dentists do. And that basically involves checkups, taking x-rays, and I can actually carry out fillings on both adults and children. And with children, I can even take baby teeth out as well as make like little baby crowns if they are needed. And then the big thing with hygienists and therapists is there's also something called direct access, which means anyone can walk in off the street, see me as a hygienist therapist, and be treated under my full scope of practice without having to see a dentist first. Now, for most routine work, that is what I do, and that is absolutely fine. Anything that I can't do then gets referred on. So things like braces, root canals, taking out adult teeth. I can't prescribe medications or antibiotics. But most of your routine stuff, you can see either of us.
And that's a really key point to remember, because all the preventative stuff, if you can't get in with the dentist, you can get in via direct access with a hygiene therapist. We all know the headlines that were coming out last week about 3-year waiting list to see some NHS dentists and people not being able to afford certain treatments. So if you still are struggling to get in with a private dentist, for example, as well, you can consider going to see a hygiene therapist. If they are worried about you, they will then refer you onto a dentist. And the great thing is, within our house, we've got the specialist team. We've got me as the general dentist, so Anna just literally can pop in next door. So that's that for the differences. Now, let's go on to when it's important to see us. So Anna had already mentioned that you may see her more than you see me. A lot of the work that I do is cosmetic work, so it's elective cosmetic work. So it's work that perhaps some people don't need, some people do need it, but they choose to get bonding and veneers because they want to enhance the appearance of their teeth. Now, what I always say is, and I want you guys to think about this for whoever's watching, how many of you accept the fact that when you go to a hairdresser, or when you get your lashes done, or when you get your nails done, that you expect maintenance, that you expect to call your beautician, technician, or whoever to maintain the work that you've done? If you get highlights regularly, your hair cut regularly, you're okay with that. But what I find interesting is that a lot of people believe that when they get dental work done, that's it. It's a one-off and it lasts forever. That's not true, because like the additional treatments that you get, beautification treatments or treatments to restore certain parts of your body, it requires maintenance and commitment, and that is the same with cosmetic dentistry. So if you're having bonding added and veneers added, these are foreign materials in your mouth. A lot of them have been designed to be biologically compatible, but the really important thing is that they need to be maintained and looked after really, really well. So what I say is that often the gums can react to the cosmetic work, and so I always send people to Anna before I start the cosmetic work, because she can go into all the oral hygiene, how to brush properly, diet, go into areas that you're missing, give you some kind of top tips on which gadgets to use and so forth. Then they have the cosmetic treatment with me, and then I say that you should see her every 3 months and me every 6 months, because she can do a deep clean of any of the areas that we've restored, check your oral hygiene is up to scratch, watch any areas that aren't being cleaned properly or being missed, and give you those top tips, and then always liaise with me if she's worried about certain areas in the mouth or something that's gone wrong. For example, angry gums do not mean healthy mouth. It's not all about the white stuff in your mouth, it's about the pink stuff. I would say, and the pink stuff I'm representing. Anna makes sure that the gums are looking really great and really healthy, and so I say that it's before treatment with me, then after treatment with me every 3 months. It could be a little bit later if we deem that you're suitable for that and you're amazing with your oral hygiene and so forth. So what would you say to that? Agree with me?
Absolutely. No, absolutely. The other thing to remember is that while you are on a smile makeover journey, your needs and your oral hygiene routine may change. So there may be times when, for example, if you've had some oral surgery, we may actually not want you to brush particular areas, which therefore means it's my job to kind of get in there and do that for you. Or if you're having Invisalign, the spaces between your teeth might change, so therefore the interdental aids you're using will change. I always say to my patients, I'm like, if you're embarking on a smile makeover and you're spending X amount of money, quite often a significant amount of money, it's like you've just bought a Ferrari. I am the MOT guy and the valet, okay? You need to see me. You wouldn't obviously trash the inside of your brand new car. You would look after it, and that's like essentially what I do. And anything, like Rhona said, if I watch the work and I see all that bonding's looking a bit discolored or it's chipped or something, the integrity of the work is in question, then I know exactly to basically refer back. So we're always looking after you.
Yeah, 100%. And as we said, it is a duo, it is a symbiotic relationship. So, we have covered a few things today. We've covered the differences between a dentist, a hygienist, a dentist and a hygiene therapist, dentist and specialist as well, which I'll go on to another video when I have my specialist team with me. And it's really important that your needs are being met. But in short, you really should see the dentist every 6 months, hygienist every 3 to 6 months or more, depending on your needs. And you'll have a tailor-made plan. But if you don't look after the work, if you don't come in for maintenance, it will fail, and that is a guarantee. And as I said, you're used to maintenance when it comes to other parts of your life, so treat dentistry as the same thing. It's not there to last forever. And even if you have a mouth that has no fillings, you still need to come in for routine checkups and so forth.
Regardless of whether you're embarking on a smile makeover or not, prevention is better than cure. So both, as I said in the previous video, gum disease and dental decay are entirely preventable, but they're also reversible in their early stages. So when you maintain your routine visits, that means if I spot something or we spot something together, we can jump on it. And then it means any treatment, you know, you may A, not even need any treatment, or B, it will be very minimally invasive. Also things like oral cancer screenings, I perform those at every visit. Again, early things, yeah. we are always looking at everything. It's not just that, like you say, it's not the white stuff, it's the pink stuff too. So we're always checking and screening, and it is better to pick something up early than leave it till it becomes too late.
And see you guys later.
Bye.